that's now being recorded, you're all muted. So if you're thinking, he can't hear me, there's a really good reason. It's because you're all muted, because for a technical reason, it's easier for me. Because otherwise, some of you will have your speakers up too loud, the microphones near the speakers, we get feedback. People keep talking over each other and all the rest of it. So if you have anything you want to know, any points to raise, whatever else, use the question box, which for me is just off the side here, for all your communications, and I will get to you as I can. I think we're going to wait. Oh, look at that, 18:30. For Israel, that should be 8:30. So we will start. So thank you to everybody for coming along and joining this evening. We've got 15 people on the call. A lot more people than that actually signed up. But as is the way with these things, technology defeats people. It seems that webinar technology is still quite new for people, and it's unfamiliar. So the tendency is for people to leave things to the last minute and then try and log in and discover they can't log in. So already now I'm getting the text messages, the emails, and the Facebook. They're messaging me on Facebook, asking me, can I sort out the technical problems because they can't log in? Yes, I can. What I'll do is I'll just put the webinar on pause while I sort out everyone's inability to try and log in earlier to sort out those problems. So that's the fairly typical experience of webinars, which is why I tend not to do them very often. I got nicer about these things these days. So now I've got some questions already come up here. Now, as you can see, I'm listed as Laura Robinson. I don't know why. That's my wife's name. I think she set up the webinar for me, so that's probably where the things happened. Now, let's just quickly check. Before we start, so can everyone hear me? Can everyone see me? If we can just have a yes into the, or no, if you can't, of course, but then you wouldn't know that I've just said that. Perfect. Thank you very much. I'm now suitably, yes, Laura, thank you. All right, so I'm suitably reassured that this is working. All right, so now, first question. I've mentioned recently the association of integral eye movement therapy. Now, this is something I'm going to be setting up later on, basically after the summer, when I have more time to do this. The plans for the association of integral eye movement therapy is to do something a lot more than most associations, societies, guilds, and organizations that essentially in the alternative therapy market are nothing more than that. They're just a market or marketing tool. You tend to find people who will simply set up their guild or association to do nothing more than promote themselves. They can then certify their own courses as being approved by the association of, and basically it's a way of appearing credible without actually having the credibility. Now, I'm keen to avoid doing that. What I want to do is set up a formal and proper association following the proper guidelines for associations. So one of the things that I'll be doing is having other people involved. We need to have a committee of people. Initially, for the first year of the thing running, the committee will be pretty much assigned by myself. People propose themselves and I'll assign the jobs accordingly. After 12 months, we'll have an association election, so people can be forwarded or seconded, proposed, and anyone that wants to drop out of what they were doing before can drop out. But essentially, I need to get some people involved in doing stuff to get the whole thing started. Now, just some of you already know, insurance companies, therapy organizations, companies that give insurance for therapists, already recognize integral eye movement therapy as a formal training. It's an insurable category. We're getting an increase in interest from various organizations. At the moment, I've got a university who is looking at some of the applications of IEMT. It's not a formalized thing just yet. I've got a meeting later this year to try and get that formalized. We have a lot of interest from the military, both in the UK and overseas, and other stuff that's on the periphery but isn't really particularly formalized. What I would like to do is actually coordinate things a lot more effectively to basically promote the procedures of IEMT, but also to look at some element of research and monitoring feedback, what works, what doesn't work. How much of the material that I put together is just artifact. For example, the difference between the figure of 8 movement and the straight lines. is that actually clinically necessary? Is there actually any evidence that that makes a difference? Or is it just an artifact that is a bias from me, and actually we need to change some of that stuff? So we'd be looking at information gathering and putting together some kind of research proposals. Let's just... the other thing I'll be looking at is a complaints process, but for both complaints against trainers. We've got a number of trainers who are certified this year, but also against practitioners. So we have a code of conduct, a thing of ethics and all that kind of stuff. I want to have a regular set of meetings, whether they're sort of formalized in person or we could do it remotely. Really just so it's not one person, as in me, controlling the association. Essentially, I want it to be a committee-run, group-led group organization, as opposed to a marketing tool for me. Now, some of you will be aware, I'm pretty much putting back on teaching IEMT. For branding purposes, I'm moving much more towards the metaphors of movement, primarily because that's where my interest is. I'm doing one more, I'm looking at the calendar here, got one more training in the UK in February next year. I've got a couple overseas this year, and that's pretty much going to be all I'll do. I'm going to be stopping after that, but I'll still be running the association and overseeing trainings and stuff like that. So I'm primarily passing the trainings over to the people that are certified as trainers. Good news for them. I'm hoping more of the trainers will actually capitalize on that accordingly. So if people want to be involved in that, I'm going to be essentially inviting people to put forward, to propose themselves, and any suggestions they have and prior experience and stuff like that, so we can actually get the thing up and running. Sonia, does that answer your query regarding that? I'm going to just get you to type in there if there was anything else. If not, I shall move on to some other bits and pieces. Lovely. Thank you, Sonia. I'll just remove that from the list. Okay, now, next question on the list. Okay, this is from somebody asking about post-traumatic stress disorder. They've been working with a client who's had a 6-year history of post-traumatic stress. The event was 6 years ago. Has had prior treatments with another therapist, and during that time has discovered that they have other events in the past which are presumably traumatic and problematic. So how to work with that? Now, this is where it gets complicated. And for me, the complication is my lack of trust of the majority of therapists who are doing any form of memory or regression work, which essentially is what IEMT is, of course. There's the huge issue of recovered memory therapy, which is therapists using techniques to elicit memory of trauma from clients who may not have any memories in their conscious awareness of trauma. There's the concept of what they call massive repression. Massive repression is the traumatic event was so intense, your brain switched it off and you have no access to the trauma. It's like aliens abduct people on a regular basis. They abduct them and then do a mind wipe, like in the movies, because the experience is so traumatic, the brain just wipes it. And the only way that the memory can be recovered is by therapy. Nothing else works. Science and common sense. No, it has to be therapy. And the ridiculous techniques of the recovered memory therapy movement. Now, for those of you who want to know more on false memory, which is the presupposition of you have a, say, eating disorder. You must have been molested as a child, but I don't remember being molested. Aha! That's because your brain is repressing the memory, which is why you can't remember it. Therefore, we must recall the memories. Now, what tends to happen is you get a self-selecting process. Some clients go, this therapist bonkers, and they leave. Other clients are quite vulnerable and often are looking for an explanation, and so the process begins. And often there can be a collaborative process between client and therapist to elicit these memories of supposed abuse, which may never have happened. It's always interesting to me that it's serious sexual abuse satanic abuse and alien abductions are the memories that people forget. They never forget things like bank robberies and abductions and car crashes. They don't forget those things. They only forget the stuff that therapists enjoy therapizing. So the first thing I'd want to know is that what's been going on? If some of you who were there in the workshop in Israel, this was an issue that did come up just briefly when somebody said they wanted to have empathy with somebody who had memories of abuse, but they didn't have those memories of abuse at the commencement, at the beginning of therapy. It was only as the year of therapy went on that the client started to recall the trauma. That makes me very, very suspicious that is this genuine or not? It's a very hard thing to forget. Now, there's another effect that can happen with therapy. People are very good at emotional or kinesthetic denial, which is basically the putting on a brave face. No, that doesn't bother me. I'm emotionless about those things. And people are very, very good at basically bullshitting themselves and bullshitting other people that they don't have the issues that they have. The classic drinker who says, I haven't got a drink problem. I just have to drink 10 pints to relax. That's the kind of tough guy that I am. I just drink to relax. It takes 10 pints of beer to relax me. And they think that's a really good thing. So they have this kind of reframing of the behavior that's clearly problematic, and they're able to reframe it to something that's different to what it is. Now, a lot of people are able to do the same thing with past events. So they can reframe so many of their experiences to be something different kinesthetically. Here's an example that I had. In my early 20s, I worked in the accident and emergency department. And whilst working there, I had to deal with a lot of pretty unpleasant things. Now, I really, really enjoyed the work that I did. I enjoyed the scenario, and nothing bothered me. I don't think I had a single experience the whole time there that was upsetting. Now, I sometimes struggle watching medical programs because there's a two-stage thing that happens. I look at some of the events that I see on these programs, and it reminds me of things that happened that I saw when I was younger. They didn't bother me 20 years ago. But the other thing is, I see how I used to behave in my early 20s when I worked in accidents and emergency, and that bothers me. There's many, many things that I did, ways that I was, not so much how I felt or what I did, but just my ways of being, that I look back on now with quite a degree of shame. So I've had experiences in accident and emergency that at the time I didn't believe to be traumatic because of the way that I was being. Now I can see how I was being. The reframing of the experience has changed. I'm also now exposed to not only the shame of my own behavior, but also the trauma of what I was witnessing, what I was experiencing. So sometimes with therapy, as people start to get insight and they get a wider emotional literacy, so rather than having their very narrow, controlled set of emotions, they're actually able to be much more competent and experience the different emotions that come up. You can start to find that some people will experience past events differently to how they experienced them before, because the ways that they've dealt with that all their life has changed. This is why sometimes we'll find in doing IEMT work, a person can come in fairly okay and they appear to have a complete breakdown and questioning of identity, questioning of self. There's this crisis of who they are as these emotional things start to change because they start to reevaluate how they have been in certain experiences. So these are the things I'll be aware of in working with somebody who has recalled traumatic events that they weren't necessarily recalling prior to therapy. So I want to differentiate how much of it is nonsense that is actually the collaborative process between therapist and client, encouraging them to be more and more of a victim, and how much of it is a reframing thing. Now, when the client is coming to see me, the post-traumatic stress client, the two primary things I'm looking at is they want other people to understand them, and they want to go back to being the person they were before the trauma happened. And those are the two patterns that seem to recur time and time again. So I'm going to address those two issues to begin with. I'll just come straight out with it and tell the client, these are the two most common things that I see, and have a conversation with them about that. I will also then draw up the chart for, hopefully most of you will remember, which is there's a straight line, and then there's the before, during, and after, and then there's what they did, and then what others did. And I'll quickly go through that process using 2 or 3 case studies of other people. And essentially what I'm looking for is the 6th point, the last point, which is what you, the client, did in the trauma that bothers you. The principle being that people aren't bothered by what happened to them, they're bothered by the part that they played during that thing. But to ask a client straight out, so you're bothered by what you did whilst you were being attacked, is a little bit too harsh. It's too accusatory. So it's easier to do it as a dissociated thing, taking other people through. Taking them through the process, and then saying, do you know what I'm talking about here when I talk about this thing, what I call the linchpin, and then I'll work with that. Now, when you have multiple traumatic events, often the linchpin is the same, but that's not necessarily going to be true in all cases. You have to take it on a case-by-case situation. If I look back on, say, my experiences working in trauma in my early 20s, there's a fairly consistent feature. What my linchpin is, what the thing that I did that bothers me wasn't so much a behavior of what I was doing, it's more about how I was being on the inside of me. And that's pretty much consistent throughout all of those experiences, because that's who I was at the time. Not a person I would really care to hang around with myself. I didn't even like hanging around with myself back then. So just checking with Snit, does that answer your question about what to do when you've got a PTSD client who's recovered further trauma they weren't familiar with prior to therapy with you? So you can just give me a yay or nay and just tell me if that has answered that one. Lovely. Thank you, Snit. Right. One of my Facebook friends is seeking a support group for dealing with a tantrum. Should I suggest myself try IEMT to help her? Well, it all depends on how old the client is, but I would say yes. Tantrum type behaviors. I believe that most emotions that we have are a recreation of early childhood emotions. We were taught to be a certain way and to feel a certain way, and then we spend the rest of our lives as adults recreating those things. And people are incredibly good at basically recreating emotional distress or emotional dramas and a complete reenactment of their early life as an adult. I've seen fully grown surgeons do this. I've done it myself. I realized in relationships, way before I got married, I realized that I was recreating exactly the same dramas that I had experienced as an early child. Again and again and again, I was just recruiting different players into the drama. So there's a degree of recreation of stuff. If you've got the person who's saying they need help dealing with the tantrum, the difficulty you're going to have until you actually work with them is knowing what they mean by that. Because if they have a tantrum, this could be a intense behavior that they're exhibiting on the outside, but they're feeling something else on the inside. It might be an anger issue, it might be anxiety issues, it might be fear, it might just be an overwhelm of a kaleidoscope of different emotions. So the question is going to be where you start with that one. On a score out of 10, how strong is this tantrum? May not be the best question. I would start off with the test process. So do you have a memory that's negative, something that stands out in your mind that's vivid? And just do a quick test to see if that works. And then I would say, okay, so the tantrum you have, what does that feel like? What are the feelings that lead up to this? I mean, tell me a little bit about that. As soon as you get an emotional connection, go, this feeling here, how strong is this? because it might be quite difficult for the person in a session with you to recreate the feelings of a tantrum, because often these things are a culmination of, it's the end result of a process that might have been going on for some time. So you may want to distill down some of the emotions that lead up to it, ones they can access there in your office, as opposed to having to be in the situation or the context in which the tantrum occurs. One of the things I would be very good at with this, I would treat them like an infant. No matter how old they are, I will start treating them like a baby. I have a bit of an attitude about them as well. I will take very much a parental type role. I will switch my dealing with the person to being something that reciprocates what I perceive to be a childish behavior. I treat the person like the childish. And whatever they do to try and evade that, I will still continue anyway. I suspect I would be able to get to the tantrum quite quick with that process. Now, this is somebody who's already connected to you in some way. You may not be able to do that if you've already got a pre-established relationship. It can be quite difficult to change that paradigm. Good luck with that one. Let us know how it goes. Right, clicking down the list here of things. Okay, we've got something from Khan here, which is IEMT ethics, an eye for an eye. Let me just write that one down. That could be kind of interesting. Eye for an eye. By the way, on the promotional front, you've seen the integralmovementtherapy.com website. If any of you have any articles or video or images or cartoons, it can be serious and fun. It can be ridiculous. You've seen the videos I put up on YouTube. If you basically have anything that both promotes you, your work, and IEMT, and it's of good enough quality to put on the website, send it over to me. I'm always looking for more content. Essentially, everything that's on there is written by me. I would like to see a lot more people contributing to this stuff. Just to give you an idea, the hit rate on the website is between 50 and 100 a day, which is pretty good. I get an awful lot of clients from that website, even though essentially it's not promoting a client service specifically for me, but it does generate a good number of clients. So I'm going to recommend, if you do have any content to put on the site, even if it's humorous, let's say if it's images and cartoons or video, or a presentation that you want to give or a client session, send it over. Right, move on to the next one. Right, I had a client that cannot follow my finger, what to do when the client distracted with thoughts and cannot concentrate. Yeah, good luck. There's a number of ways that some people are able to not do what it is we're asking them to do. Here was one of my favorite ones that I saw. If I was doing this with my finger, her eyes were doing this. So there was a kind of a lag by about a second between where my finger went and where her eyes went. Her eyes went exactly where it was that I was asking them to go, just not at the same time that I was. And this was one of my quite early clients. The interesting thing was she presented to me as a complete victim. She was somebody who life had basically screwed her over, and she'd got into bad relationships. Financially, she'd never done well. She had got very low educational level and had just basically not succeeded and largely depended on welfare her entire life. She seemed to be quite cooperative in all other ways and quite nice towards me. And despite me giving her a bit of a hard time to follow the finger, after the session, about an hour, maybe 2 hours after the session, she sent me a very unpleasant email that basically said she felt that she had been fooled, ripped off and conned by me, and that I should realize that we're not all as stupid as you seem to think we are. I thought, oh God, she knows me well. There was a kind of a mismatch, which was, I'm going to do what it is you're asking me to do, but I'm not actually doing it. And I suspected that throughout the entire session, she was probably feeling that way about me and about the session, but hadn't actually revealed it to me, she was still able to give me all the social graces to fit into the social norms of interaction. And afterwards, obviously, the thought of me going around, and she felt compelled to write the email. Sometimes, though, people are too hyper. They're jittery all over the place, and they can't really, they can't really speak very clearly because they're just all over the place. And if you start speaking, they go, yeah, I know. Oh yeah, I know what you mean. Yeah. Oh yeah, I know what you're saying. Yeah. They can just be really hyperactive. The trick with that person is to get them to slow down. Now, I haven't always managed to achieve this. I've had a couple of clients in the last couple of years that I can think of that I've actually asked them to leave the session, simply because the moment that I start speaking, they're not listening. They're just going, yeah, oh yeah, like they already know what it is that I'm going to be saying, and they don't need to listen because they already know. People who don't listen don't need to listen because they already know what it is you're saying and they know what you mean, even if they're wrong. But they never actually expose themselves to the evidence that they might be wrong because they never listen. When you have somebody like that, there's a number of options you can do. You can point it out to them that this is a behavior that they're doing, but often they'll tell you how much they already know that is what they're doing. Sometimes they'll just tell you, I can't help it. I've got hyperactivity disorder. It's not my fault that I'm behaving in this way. These behaviors aren't my responsibility. These behaviors are for you to sort out and not me. And that's a very common position that some people will create. And I'll go, I don't think so. Thanks for dropping by. Out you go. And I'll send them out the door. I've had 2 people in the last couple of years that I've done that with. It can be quite a challenge when you have people that are basically so distracted. You may want to consider doing another approach before you start thinking about doing eye movements or something that requires a focused concentration. One of the techniques that I have is I'll give them a big box to hold. Literally, I've got various things in the room here. I haven't got any boxes in here now, but I'll give them a big box. Because to hold a box, they have to kind of start to hold their body a bit still. I might do a relaxation exercise, get them to do some breathing stuff. I might get them to slow down their internal dialogue and calm that down. I might do something entirely different. I might send them out the door again. Not everyone is going to be able to do the eye movement stuff. It's that simple. So good luck with that one. Let us know how it goes. By the way, on the forum, I've put a section on the website, on the integraleyemovementtherapy.com website. On the forum, I'm asking people for things going wrong. What are problems that arise? Are there any negative side effects? Are there any difficulties, any negative reactions? I'm looking for any case studies and any data regarding these things. I'm very keen for people to come out of the need to be seen to be a successful therapist. The NLP world has very much had this, I see people one time and I never see them again. I tell them the magic story, I do the 6-step swish pattern, and they're fixed forever. Yeah, right. That's called bullshit. It does happen occasionally, but it's not the norm. And very few people are ever willing to talk about the negatives and the client sessions that didn't work and the ones when people want their money back or refuse to pay, or they complain to their families and the families turn up with flaming torches at the door, that kind of stuff. These are the sessions I want to hear about. For me, this is where there's a lot of information and a lot of evidence for things happening that we can learn from. Just so you know, on my main website, 23nlpeople.com, there's a whole load of negative testimonials. These are people who hate me. These are people who've come to see me or had interactions with me who say, he's a charlatan, he's a fraud, his stuff didn't work. Who does he think he is? I'm the only person I know that puts negative testimonials online. I don't recommend you do that. It'd be good if you did, but I'm not suggesting you should do that. But I would like to hear a lot more about the things that don't work, as opposed to this need that everything is always successful, always. Just before the workshop in Israel, a couple of people did contact me and say they wanted to know what the success rate was of working with IEMT, and is it guaranteed to cure people? To which I said no. Okay, can you speak more about recommended ways or times to use the question, and when is the first time you can remember someone else feeling that emotion, and when best to introduce the question? Okay. Some people tuning into this won't know this, because this is from the advanced or the trainer's training. The typical algorithm of working with IEMT is, first of all, identify the feeling. How strong is the feeling? How familiar is the feeling? When's the first time you can remember feeling this feeling? It may not be the first time it have happened, but it's the first time you can remember now. We can pivot on that, because a lot of emotions that we have are actually learned from other people. Not always. Sometimes we have a counter-reactive emotion. So father, say we have angry father. And if I grew up in an environment where father is always angry, there are two things that could happen. There's probably others, but we just go for these two. I could become very, very anxious around angry father, and later become very, very anxious around angry people. If I get bullied by father at home, I may well go to school and those types of personalities recognize my reciprocal anxiety emotion, and they might seek me out, and then I get bullied by those children at school. But there's the other one, which is I see fathers angry, and I learn to be angry. So then I go to school, and I become the child who displays and demonstrates father's behavior in the playground or in the classroom at school. So sometimes we can have reciprocal emotion to what we learn, and sometimes we learn the emotion from other people. And of course, there's all the other variables, whatever they are. So one of the questions we can ask is, so how strong is the feeling? How familiar is the feeling? And when is the first time you can remember someone else feeling this feeling? Now, it may not be the first time they ever felt it, but it is the first time that you can remember now them feeling this feeling. This works really well for anger, because anger is often copied from somebody else, or modeled or mimicked or learned from somebody else. But here's some other stuff you may want to consider. How many people who are depressed had or have a depressed parent? Think about how difficult it is if you're, say, 3 years old, and most very young children are pretty narcissistic. They lack empathy, and they don't do very well in understanding other people's emotions, because it's me the whole way. Some children are much more empathic than others. I look back on, say, my own childhood, and I didn't have any empathy for anything. It's actually quite shocking to me how it is possible that I could have been the way that I was when I was a child. But what happens if the child, say, comes in from being in their own happy little universe, and they come home to find mum, or they come into the room to find mum crying, and it's the first time they realize that something's very wrong? And now when mum's in that mood, child is also in that mood. The child learns how the world is by reading mother's or father's emotions. And so mother's not very nice at the moment, mother's not very happy at the moment, there's something very wrong with mother, mother's just not very happy. Therefore, the world is not a very happy world to be in, because our worlds are very small when we're small children. So you can have what could actually just be a, say, 6-month depression in a mother or a father or anyone living in the child's experience. So a 6-month nervous breakdown. But the impact on the child can be huge, because they've learned that that's how the world is, because mother is the representation of how to feel in the world. And now as an adult, they've learned to model and do those emotional states, the ones that they had as a child. And so now there's somebody who takes antidepressants but doesn't really understand why they're so depressed. And they remember a really happy childhood. They have a vague memory of this time that they found mother crying. So those kind of scenarios you may want to work through. So how strong is this feeling of depression, for example? When's the first time you can remember somebody else feeling this feeling of depression? In fact, you may want to do that with any emotion. Ones that impact on other people the most: anger, anxiety, guilt. The three biggies: anger, anxiety, and guilt. I will quite often ask that question. And when is the first time you can remember somebody else feeling this feeling? That will often lead you to identity stuff as well. The other thing that can happen is you get some very interesting reactions. Because if the first time I can remember somebody else feeling this feeling, say I was 4 and its mother, we're not now working with me, we're working with somebody else. So we have a personification of depression. So some of the things you might want to consider: if the person talks about the depression gets me down, the depression follows me everywhere I go, I'm fighting the depression, I'm battling depression, I might ask some questions like, so you're fighting depression, who or what else do you fight? And in the past, who or what else have you fought with? Because to keep it really simplified, I fight with mother, I fight with depression. Mother was depressed when I was a child. So this will give a good indicator that you work with the depression and the subsequent emotions using the standard IEMT process, but then you also want to consider, and when was the first time somebody else felt whatever the feeling is that you're working with. What I recommend, just experiment with it. If you do, I know Mickey was doing the practice group. You might want to consider actually running that as a practice group event, where that's the only thing you do. You just repeatedly go through different emotional states that the person has and ask them, when is the first time you can remember somebody else feeling this feeling? Okay, and we've got an addition. Oh, hang on. Okay, now moving on. Does dealing with repressed memories, imaginary or not, have any therapeutic at all for client, or does it just make things worse? It actually is the single most dangerous activity known to man. It really is. I can't remember the exact statistics. Robert Anton Wilson wrote about it, and there's been a lot of research on this. The death rate from people having recovered memory therapy who go on to kill themselves or be killed in suspicious self-administered circumstances is huge. I mean, it is horrifically huge. The reality is, if a person, say, has been sexually molested as a child, remembering more sexual abuse isn't going to have any therapeutic benefit. If a person doesn't remember it, it probably didn't happen, or it's pre-neurological encoding of memory, so as an infant. So recovered memory therapy is an insane therapeutic approach. I'm going to try not to rant here. There is a very nice, well-intentioned lady who works about 25 yards from my front door. There's a therapy center literally across there from here. And she's a recovered memory therapist. And what this insipid, very nice, well-intentioned lady does is basically diagnose every poor soul that comes through her door as being molested as a child. It doesn't matter what the problem is. She will find, when the people say they don't remember, I don't think so, she'll say, ha, because you've been repressing it. And then she embarks on this ridiculous therapy. Pure hypnoanalysis. Pure hypnoanalysis. The pure hypnoanalysis guys don't like me very much because I call them on the fact that there is no evidence for what they talk about. There's no evidence for what I'm talking about either, to be honest, in terms of formal research. But I do know that pure hypnoanalysis, regression to cause when there is no cause. It's a very dangerous activity. Some fantastic books. Richard Offshee Offshee is OFSHE, Richard Offshee, and the book is called Making Monsters. Buy that book. And the other one is by Mark Pendergast. It's got an unusual spelling on Pendergast, but it's called Victims of Memory. That's about that thick. It's huge. Buy both of those books. They tell you pretty much everything on recovered memory therapy. It's just ridiculous and very, very dangerous activity. Huge suicide rate. All right. Is it possible to change negative behaviors using IEMT? No. Okay, so is it possible to change negative behaviors using IEMT? Here is how I think about these things. IEMT is my treatment of choice when life has screwed over the client. When the client is screwing over life, as in it's their behaviors that are the problem, and they are the one who are causing the difficulties, I'm going to use other approaches. But when the person has a historical record encoded in their brain that dictates how they feel, then I don't think we're going to see any behavioral changes unless the behaviors are a direct result of the kinesthetics that they have. I know that Robert Dilts has done some experiments in strategy change using eye movements. And I know that Steve and Connirae Andreas were also looking at behavioral change on the presupposition that visual, auditory, kinesthetic, internal dialogue resources move the eyes around the different things. We bring together all the neurological resources to learn to think about things differently. I'm not in agreement with that being what happens. I know that you move the eyes, it changes the picture. It may not change behaviors that people learn to do. There's going to be other approaches that will be better for that. Okay, now going back to the question, the person who was basically not moving their eyes, she was shocked and just basically sat there, not moving her eyes. This sometimes happens. Some people, the traumatic events that if it's post-traumatic stress, for example, or the event that they're thinking about is just horrible. It's just emotionally horrible, even if there's not much happening externally. Some people, the moment they think about it, they're just kind of like drawn in. Or they do this to think about it, and they're just like, oh, and they disengage with you. What I'm going to do is I will change their posture, change their physiology first. I've got all sorts of props in the corner here. I've got all sorts of weaponry, as some of you know, I collect. I've got bells, I've got boxes, I've got all sorts of things. I've got juggling balls. I haven't got it anymore. I used to have one of those children's balls. It's like a round thing with foam bits coming off, and it vibrates. Little kids love these things. That can kind of be interesting. To get one of those children's toys that jumps around, switch it on, get them to hold it, and then do the eye movements. Because you're giving them a different sensory position, and it's not so easy to get lost inside the memory. For some people, it's just too much. So I've had people lie on the floor, I've had people stand, put their head down between their knees, and then I've done eye movements that way around. There's all sorts of things you may want to consider doing. Sometimes you may just want to just get up, stand up, start walking around, go for a walk somewhere, and do the session that way. Okay, question. Do you think IEMT therapy via Skype is possible because of the limited camera field of view? Do you think it would work? No. I tend not to do any form of IEMT work remotely, principally because people disengage, they look away. It's very hard to get them back again. If people have the classic abreactional process, I can't control for that. So I don't do any IEMT work remotely. That said, I've done it one time over the telephone, predominantly because that individual requested that I do IEMT. The Skype session didn't work. There was an incompatibility between the my computer and their computer. So I did this remotely, I believe, by phone, if I recall, whichever way it was. But they couldn't see me and I couldn't see them. It worked. They seemed quite happy with the way things went. I've only done that the one time. It's not something I would seek to do actively. But I can imagine for some people it's possible if they're able to follow the instructions and self-initiate the eye movements. The finger movement, of course, isn't really necessary. All I'm going to do is move my eyes. Okay, that's all that's really happening. Someone else saying, reminds him of the client with back pain. After the work, his pain got worse and he didn't want to come back. It's interesting. I haven't actually had that happen that I can think of or recall right now. Sometimes people do go out of the session, both in all of my therapeutic work, whichever process I'm using, people do go out complaining that they're worse than when they came in. And I used to panic. I used to get quite concerned when people did that, because that's not what's supposed to happen. What I've learned is that generally, over a long time, those are the clients that generally report the biggest results. It's just sometimes you might just need to get them back and continue the work. Sometimes they continue it themselves. When a client session ends with a nice conclusion and it's all wrapped up and it's all lovey and everyone's happy, often because it's concluded, the client doesn't think about it anymore or continue any of the work. They're just expecting to have an outcome or a result that persists across time. When people don't get that and the session just ends and they're still stirred up, they're not feeling that great, and you send them out the door again, they're going to be thinking about it, and they're going to be thinking about it in a lot of detail. Those are the people I will make sure I have a verbal, either by phone, by Skype, whatever, but by voice as opposed to just by email. I will have a conversation with them shortly afterwards, just to make sure they're continuing to explore it and to see how they're doing. But it's worth, with your clients with an increase of back pain, I can see no reason why moving your eyes while you think about memories is going to give a person back pain. It might change their perceptions and some of their coping behaviors and strategies, but I can't see how it's going to induce a back pain if the pain is physiological. Time will tell with that one. Okay, now regarding identity questions. People often get very confused around the identity questions, particularly when asked, and where is that I? Yes, they do. The trick in doing identity elicitation is to basically set up the differences between I, me, self, and you with as many examples as you can possibly think of. I will happily spend 20 minutes, maybe longer, talking about I, me, self, and you, and giving all the different variables and permutations of those things, so that when I go to ask the question, they understand the linguistic reference, at least, of what it is I'm asking for. Now, the opening question, and when you think about I, where is I? Some people go, I don't know what you mean. Where is it? Well, when you think about I, where is I? Well, I suppose it's in my head. Okay, I don't want you to suppose anything. I want you to answer the question. When you think about I, where is I? Well, okay then, I guess it's in my head. All right, I don't want you to guess anything. When you think about I, where is I? So sometimes you'll just need to keep going with the question and pay very careful attention to the structure of the answer that they give. What I found is that as time went on, the more that I did this, the easier and the quicker it became. And I don't think procedurally I'm doing anything necessarily different to what I did before. I think the difference is I'm hearing the answer differently to how I did when I first started doing this. The first 100 or two will be difficult, and it does get easier the more that you do it. When you've heard every variable for how people can be confused when you ask them a question, it will start to shape how you hear the answer and how you deal with their confusion. Because if you have a fixed question, there's only one format the question has. There's only a finite, limited number of variables of how people can answer it. Once you've covered all those variables, you'll basically be able to predict what they're going to do. And it gets easier with repetition. What I recommend is stick an advert in the paper, start seeing people for free. Do this. Do 10-minute interviews. Literally, every client that comes in, you have a fixed 10-minute time slot to do whatever the process is that you're doing. At 10 minutes, the bell rings, it ends, they're out the door. There's no introductory rituals or goodbye rituals. You'll be amazed at what you can do in 10 minutes. And you'll start to see how much stuff is actually people's social interactions based around time and social rituals, and how much of it is actually the technique that you're doing. Oh, and there's another half of the question. I didn't finish the question. And also, what was happening around that age? I keep asking the question, but they still stay really confused. Yeah, the only thing I can advise you, if you're getting a lot of confusion from people, then they're not aware of what it is you're asking them. So you simply may want to spend much more time setting up the information that you're requesting before you start requesting it. One of the things is there's a lot of clinicians and therapists feel under a huge pressure to get a result. They want to get a result as quickly as they possibly can. They feel that they have to have a measurable positive outcome within the 50-minute hour or within their hour session. Give that up. All you're doing is exploring what is possible. Drop the need for outcomes. You will relax, your clients will relax, and your clients won't feel they're letting you down when they don't give you the results that they believe that you're prompting them for. Okay, can you talk about how we may incorporate IEMT techniques as part of a regular verbal other therapy session? Yes, I can. Now, for the vast majority of people that I've trained in this process, they're only ever going to use the simple IEMT kinesthetic pattern. How strong is the feeling? How familiar? When's the first time? How vivid? Now move your eyes. That's what most people will end up doing, and they won't do any other stuff. If you're doing counseling work, and you're doing classic reflective counseling, so I hear that you're saying this, and when you feel this, blah, 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 and you're doing reflexive counseling back, the person may break down and go, I just always feel so bad when I see my father. This bad feeling that you're talking about when you see your father, how strong is this out of 10? So you may just want to use this as a way of dealing with problem emotions that emerge within the sessions of what you do elsewhere. I like to try and keep things quite pure because I can largely predict all the variables of the behavioral responses my clients will give me. But there's by no means do you need to do that. So you can just work with emotions as they arise. Other stuff with identity. I just feel such a fool when I see my father. So we've got the feelings of feeling a fool, but I feel a fool. So you can work with identity level there. So rather than having specific techniques that you apply to the client, you're working responsively to the stuff that they give you as you're going through stuff. Okay, you're back. Good. Okay, so what do we do in IEMT if, heaven forbid, we get some good emotion in the client? Do we stop? We try to go to different methods to strengthen the feeling in them, future pace, etc., or something else. Now, it's a good question. So, a miracle of miracles happens. The client feels better. They sit there and go, hurrah, I feel good. I go, brilliant. Give me the money. I tend not to get involved in future pacing. I used to do a lot of future pacing. Get a positive state, future pace the person. I wasn't overly satisfied with what people reported back afterwards. In my own experiments on myself, I wasn't satisfied with what I reported, what I was feeling afterwards and what I was doing. The exception to this is the 6-step reframe from NLP. I found the 6-step reframe an astonishingly effective technique both for myself and with other people. And I've got a number of first-hand experiences where the 6-step reframe and then the future pace at the end was superb. But what it was they were behavioral future paces. They weren't kinesthetic future paces. And I think that might be a difference. What I tend to do is with IEMT, I use this largely remedially, so to remedy negative states, negative emotions, negative traumas, all that kind of stuff. When the person is feeling better, I personally, I leave their future to them. I'm not getting involved in anything that happens tomorrow or next year or the following year. It seems to me that there's an ethos that I think has come out of NLP, which is that we do a technique on somebody and they live happily ever after. We do a swish pattern and they're changed forever. There's a massive overestimation of the effectiveness and the impact of NLP techniques and other therapeutic mediums that people use. And I think these are massive overestimations of their power. People talk about a powerful technique. I'm not so sure about that. Essentially, I'm just going to work with the problems that the person has presented to me. I tend not to do too much. I don't do future-facing stuff. I don't see the value in it. What you have is what I believe is nothing more than a ritual. When I anchor the positive feeling or the positive state, and I now get you to imagine yourself there in the future feeling this feeling, that's a ritual. It's called fantasy, it's called imagination. But I don't think it actually is it might look impressive as a therapist and it look impressive to clients and to other therapists. Whether it does something, I question that. You spoke about 3D eye movements. What is the application of that? Here's something you may want to experiment with. What we found was focal length. So if I put my finger here or finger here, there isn't actually a great deal of difference. One of the things we played with in the experimental groups, get the person to think about the memory. So access the memory, so it's here. Then put your finger where the memory is and get them to think about the memory and then move in and out. So essentially you're leaving the eyes in the same axis, but you're just changing focal length. Now, what you tend to get is some shift. Obviously, if something gets further away and blurrier, it doesn't feel as strong. But you don't get any long-term shift. You can create a temporary shift, but actually it doesn't seem to make any difference long-term. But experiment with that. Find out, if you do a practice group, just play with it. Something else you may want to consider. Because of the way the eyes focus, we've got 3 axes. We've got 2 eyes that focus in this plane, they focus in this plane, and they focus in this plane. And hopefully they all line up in all 3 axes, and then we've got really precise vision. Some people have deviations, you see, which is why you have glasses of different strengths and different things. So the way the brain represents stuff, if I hold one eye closed, this eye is only seeing a certain portion of experience, but also the information from this eye is going to specific parts of the brain, which is not where this information is going. So think about a traumatic event or any memory that's vivid, hold it in mind, keep focused on the memory, and then cover one eye, and then switch, and then switch, and then switch. And then try that at different speeds and different rates. And watch what happens. The trick, you must keep thinking of the memory. That's the important detail. Now, there's a number of different things happening neurologically. One of them is, when I cup this eye, the pupil here is now dilated because there's no light coming in, so it tries to maximize light input. When I do that and switch it over, there's a sudden overwhelm of light coming in, so it whites out momentarily, and then the pupil constricts, and then this one dilates. So it's not just that the picture is also jumping side to side in where we perceive it to be, but there's also pupil dilation that happens too. Play with that and report back your findings. I won't tell you what happens. But these are some of the things you may want to experiment with. Weirdly, up and down movements, nothing happens. Nothing that's noteworthy happens. What is the difference between doing the crazy 8 and the regular, what each is doing? Okay, now, what I've been teaching people is that when you're working with kinesthetics, so working with emotional stuff, you do straight lines. When you're doing identity stuff, you do figure of 8s. I don't know whether that's actually valid. The reason that came about was that I recognized in the early workshops that I was doing, I was getting a significant number of people freaking out. Abreacting. I had people running out the room in tears. I had people convulsing on the floor. I had people just going nuts. And all I was getting them to do was move their eyes. I started looking at the different variables, and I started playing with introducing variables. One of the things I did was, for all the identity stuff, I did straight lines. For all the kinesthetic stuff, I did figure 8s, increase abreactions. For those that were at the London workshop in about 1997, oh my God, that was a dreadful day for me. That was absolutely dreadful. We had about half the group, and it was only a small group, completely freak out. When I switched it the other way, the number of abreactions appeared to diminish way down. Conversation with Dani Beaulieu, who is the French-Canadian therapist. She does impact therapy and does eye movement integration. Her work with eye movements has evolved and developed totally independent of mine. Yet she also noticed a similar thing about abreactions. Start off with the straight lines and then do the figure of 8s, and you reduce the amount of abreaction. This might just be an artifact. There might be no validity to this at all. So experiment, see what happens. Check your insurance policy. Okay, we'll explain again how IEMT can help with pain. Had a vehicle accident and broke my leg 13 years ago. I still have pain under my knee. What do I need to explore? Okay. Now, with pain, there's a number of things to look at. I'm going to first of all think about the pain itself. How strong is the pain? On a score out of 10, how strong is this pain? How familiar? When's the first time you can remember feeling this pain? So I'm going to do some work around that. What I'm not looking for is a reduction in the pain. Okay, so I'm not necessarily going to be trying to go, we'll get rid of the pain. I'm also going to work with your reaction to the pain. How do you feel about the pain? How strong is this feeling? How familiar? When's the first time you can remember feeling this? So I'm dealing with pain and your reaction to the pain. I'm also going to deal with the memory of the events itself that led to the pain. So, because often the first pain experience, the accident, it doesn't need to be traumatic, but they're very vivid representations. So I might work with those things too. I might look at your anticipation of pain. What's that like? As well as remembered pain. So these are the kind of issues that I'll be working with. Not all pain is going to be relieved using psychotherapeutic tools, even hypnosis. It's simple as that. Pain is a physiological experience that has a massive overlap with psychology and emotions. What mostly we can do is create a change in our response and experience of the pain. A lot of therapists, especially hypnotherapists, they think in pain relief along the lines of creating numbness or anesthesia. That might work well for things like dentistry, and I honestly don't understand how that works. I'm skeptical if it does, to be honest. I haven't ever seen it firsthand, but I would like to see it. I'd certainly like to see some video evidence of this. An awful lot of people having hypnoanesthesia are not having anything of the sort. What they're being given is relaxation. The surgeon who is doing the surgery is still using local anesthetic, and the hypnosis is to keep the person still and relaxed. It's really hard to operate on an appendix when you've got a patient thrashing around because they're really stressed by the whole thing. So often, local anesthesia is used. Most hypnotists who demonstrate, they do things like they get the back of the skin of the hand and they stick a needle through it. And it's amazing because the person doesn't flinch, it doesn't appear to hurt, and holy of holies, it doesn't bleed. I was a nurse for over 10 years. I stuck needles in people every single day of my working life. I can tell you, most of my patients never even noticed me do it, no matter where I stuck it, and it hardly ever bled unless I stuck it in a blood vessel. Very rare. No evidence of anything that I know of apart from how the skin works with needles. Ask anyone that's worked in a hospital. So, pain, you're looking at the response to the pain experience itself, and then things around the events that led up to the pain. Those are the key areas that I'd be looking at. But it's not necessarily going to create the impact we would like it to create. But it's worth exploring. You're not going to do any harm with it. Not quite sure. This is from, I don't know how you say your name, Hyla. What do I do when clients... what do I do when clients say it stays the same over and over again? Do something else. Remember, this isn't the grand unified theory of therapy. For some people, this isn't going to change anything. Maybe 1 in 10, you can be guaranteed this is not going to work on. There's all sorts of reasons as to why that could be. Do something else. That's the only thing I can suggest. What I always do when I'm doing IEMT work is that very first test exercise. Just think about something that stands out in your mind from a long time ago that's negative and it's vivid in your mind. Wiggle your eyes. Does that change something? If it does, I'll proceed. If it doesn't, do something else. Okay, after feeling had changed, say let's from 9. Okay, after feeling has changed from 9 to a 7, for example, and the client says it's a new emotion that he doesn't know from the past, what do you do next? Now, to explain this, so supposing the person has a feeling it's 9 out of 10. You do the algorithm, do the eye movements, and they go, oh, it's 7. And you go, okay, so 7 is a different feeling. It feels different. If it was the same feeling, it would be the same. How familiar is this 7 out of 10 feeling? And they go, it's not familiar at all. And when's the first time you can remember feeling this feeling that's 7 out of 10? Never. I've never felt this feeling before, ever. I'll persist. I will do what I call the 1,000-yard stare. Eventually, I'll put the video up where I've got a number of videos now where I actually employ this, where I just sit there and wait. Now, what happened is the person starts to get quite uncomfortable. They'll go, well, I can't remember. I don't know when. And I'll keep the 1,000-yard stare. Now, several things can happen. One is they can't access the feeling at all. It was just a question of time. The feeling changes and then disappears. The other one is that actually they're going to go into a stress response primarily because of the awkwardness that I'm creating, in which case I'm going to work with that feeling that comes up. Sometimes I might just move on and just come back to it later and see what happens. Sometimes I'll just go, oh, so that's what happens when we do the eye movements, and leave it at that. Remember, you don't have to be under pressure to get a result. Just that's what happens sometimes. Okay, I'm just clicking through. Okay, do you use eye movements when positive identity pieces come up simultaneously with clients who typically don't access those positive parts? If I understand the question correctly, basically, do I use eye movements on the good stuff? No. I did. In the experimental phase, I did some eye movement experiments on myself around positive experiences. Oh, it made me miserable. I'd like to do quite a big study. Let's get a whole bunch of happy people who had lovely, happy childhoods. People who were like those people who just naturally exude positivity. Get them to remember positive events and get them to move their eyes. And let's see what happens. I don't know. I don't know what will happen. Ethically, I'm too scared to do it just in case it does actually eliminate those positive feelings as well. There's a thing from philosophy, very much from Plato and Aristotle, the move towards the good. The general assumption was that the human, the person, is wired to always move towards the positive, and that. So I think it was Plato, the leaning towards the good. And there's been a lot of suggestion from various psychologists and therapists over the years that emotions work the same way. So if you use a emotional reduction process on a negative emotion, it will move towards the good. It might just go to neutral, but it moves towards the good. If you work on a positive, it won't lean towards or move towards the negative. It will either stay where it is or get more positive. I'm not convinced. If you're brave enough and you can find some happy people you don't like very much, they can get quite annoying, happy people, I have to admit. Let me know what happens. Okay, another question. If a client says the intensity is going up rather than down, do you keep going or do you wait? It depends. If they look like they're going to hurt me, I will probably stop. Doesn't happen very often. Most of the time I continue, and often the person goes through a threshold where they go, I can't do this anymore, and they'll disengage. They might break down, they might cry, they might have an abreaction, and then I'll wait. But I'll usually move the person. If the feeling is getting worse and worse and worse, I'll normally keep going. I will see that as a 3-stage abreaction process, in which case I'm going to push them to the threshold, and usually that gets quite a good result. What I've learned is to not panic when people say it's getting worse and worse. When I first started doing demonstrations of IEMT work in front of groups, I used to worry when some people did break down and cry and then tell me they felt worse than they've ever felt in their entire life, and they were fine before they came on this event, and now I've ruined their life and they look like they're going to die. I think I had that happen about 3 times in Israel recently in the workshop there. I've learned to relax. My experience over time is that the people who have the biggest emotional reaction during the process are usually the people that become the biggest fans of the process. Even though it doesn't look very nice, I've got to say it can look quite scary. It can be quite distressing to see a person go through that. I've learned to try and hold myself in a positive place whilst they go through it. Not always possible, of course, because it is quite distressing, as well as the slight feeling of panic that comes up. But I've learned through experience that most of the time, I can't think of any exceptions at this moment, the person comes back afterwards and goes, oh, that was amazing. It looked horrible, but they will often say it's the most amazing thing. All right, we're at time. Right, we've got 10 minutes, and I'm going to finish off. Right. Client of mine reported the change with IEMT session, but the next week she asked me, please don't do that on me. It was too painful, even though it helped her. Now, so you've got a client who benefited immensely from the work that you did, has now come back and says, please don't do that with me again. I don't think I can cope. This is one of those ethical questions that I still don't know the answer to. And I think there isn't a rule to follow for this one. I can think of plenty of examples where it's the most appropriate thing in the world to go, I'm in charge, you do as you're told, and you force them to do the change. I can think of plenty of examples where to do that would be highly unethical, potentially illegal, and punishable. I don't know what the guideline would be between those two things. And I know of a number of therapists who are very, very critical of my approaches because they say that I have no right to make those decisions on the behalf of my client. I say, yes, I do, because I make decisions on behalf of other people virtually every day of my life. Less so these days, but when I worked in a hospital, I did. And I'm quite familiar with doing that. My suggestion to people is that if you're new and this is you're inexperienced in this kind of stuff, you go with what the client is requesting and what they're paying you to do. As you get more confident, I think you can push the boundaries a little bit more, but you won't have any defense in law if this goes bad. It's a big responsibility, I think, and I don't know. I think it's one of those things when we've got the association set up. This could be one of those things we have a panel debate. When we put together the ethics thing, I would like to see a discussion, a roundtable discussion or a debate where we sort these things through and see what other people think. I think it's an important ethical question. So in your situation, I don't know. I don't know what to advise you. Good luck, play it safe, bring them back alive, I think is the important thing. Right, hints and tips. How do I do this on myself? I would like a method that will help me change or explore bad feelings on the spot when I catch them. IEMT looks fit for that, but I find it difficult. Yeah, I don't. I've tried this. Is it possible to do this, say, when I'm out and about, just before a workshop, in the interval of a workshop, when something's got me, or a person's been awkward and they've got me? No, I haven't been very successful with this. What I tend to do is make a note, and I write it down, what the context was and what the feeling was, because I don't always have access to it later. I think, oh, what was it? I can't remember now. So I'll make notes for it so I know what I'm accessing, and then I'll work on it later. Doing this sort of in the moment, on your own, in a situation can be very, very difficult. It's not something I've had any success with. What I have found in working with myself doing this, an inner contemplative attitude, directing my attention inwards as a demeanor, as a mental state to be in, is hugely advantageous in working with this one. Actually, to tell you the truth, when I do this, I'm usually lying in the bath half asleep, doing an internal exploration of stuff, and that's usually where it works for me the best. Is it better to have IEMT done to me more than to do IEMT to myself, which is preferred? I don't know. A lot of it will depend on how competent the other person is, how much they interfere with your process, and how able you are to keep track of the processes. When I do this with myself, I don't just think about the thing and move my eyes. I literally talk it silently in my head. I talk myself through. So this, like, my internal dialogue will be like this. So what is the feeling? Okay, that's the feeling. Okay, how strong is this feeling out of 10? 6, 7? No, be specific. How strong is it? Okay, 7. How familiar is this feeling? It's not very familiar. Okay, so when's the first time I can remember? When can I remember feeling this feeling? So I talk myself through the questions, the algorithms. I think what happens with that, of course, is the pacing of it that makes it easier. If I just think about the past trauma, sometimes that leads me off, and then I'm inside it, and I've forgotten that actually I'm doing a process to change those things, and I go back to suffering. So I literally talk myself through the algorithms. So what's superior, doing it to yourself or having someone else do it? I think it varies. Someone's written something here which I'm not allowed to reveal. Don't read this one out loud. Okay, I won't. I won't share that one. Okay. Do you ever start with identity work prior to the kinesthetic work? That one depends. If the person has strong negative emotions that are going to get in the way of the therapeutic change, then yes, I'll deal with those emotions. If they seem fairly okay, and it clearly is identity stuff, then I may well go straight for the identity. But sometimes if it's like anger, they're angry at their father, I might deal with the anger first. Because the last thing I want is for them to react and get angry at me over something, and then I've got to deal with that. So it's just much easier sometimes to deal with emotions first before doing identity. I don't think it matters, but going back to the early days, the observation was working with identity first before doing the kinesthetics was one of the factors that led to more abreactions, which is why the 2-day thing, kinesthetics on the first day, identity on the second day. I often have thought about switching it around, doing identity on the first day, kinesthetics the second day, but I've been too nervous to do it because of what happened in the early events. Right, we have got 4 minutes, so I'll talk quickly and we're over here. Okay, so when I'm working with metaphors of movement and a feeling arises, would it be appropriate to go outside of the metaphor work to go to the feeling? No, I don't do that. I will sometimes start with eye movement therapy to deal with past life trauma stuff and then do metaphor stuff. I never do it the other way around. I did experimental sessions where I did do that, but people get confused as to what category of information it is I'm working with. And the metaphors of movement relies on a number of things around the categories of information that I'm listening for. When I'm in Israel next year teaching that, the reasons for that will become obvious, but it's around the concept of boundary violations. What I'm doing in metaphors of movement is tracking when people jump from one logical set of information to another and where in the reporting of their experience they make that jump. If I've set that up by mixing IEMT with metaphor stuff, I'm back again. I can't really get a good indicator of what's going on there, so I tend not to. Thank you, Hila, for your kind words there. Okay, what have we got? Last question, I think. Oh, they're coming in thick and fast now. Okay, is there some gravity for suffering over change? Can you elaborate on one of the reasons? Sometimes I want my suffering and deny change. Yeah, and the work needed. It's weird, and it's actually horrible. Suffering is incredibly seductive. There's the nostalgia of suffering, something that's talked about, the romance of suffering, the romance of self-destruction. I was a former depressive, so I spent most of my 20s being really miserable. It's weird because I've had, fortunately, not recently, certainly not in the last 10 years, but I've had times once I've come out of depression where I longed for it. The kind of the comfort of suffering and it's weird. It's a really powerful thing for some people. And I think some people are overwhelmed by that romance, that comfort that suffering brings. And despite their desperation to have an improvement in their life, they're also, it's like an addict. They want the problem to go away. They don't want the comfort the problem has to go away. I think I could do an entire sort of philosophical debate or discussion on this. Certainly not now. You may want to look at, if you want to know more about the why suffering is so seductive to people, look at some of the studies from there's a centre in Holland that deal with torture survivors. And the people they deal with have been, just horrific, both physical injuries as well as mental injuries. And they have published a number of things about the romance of suffering, the nostalgia of suffering. I don't have access to that here, but if you Google it, I'm sure you'll find it. Thank you, Mindy. I'm looking forward to coming back as well. One of you, I just hit the delete before I saw it was, so I'm sorry if I appear to be ignoring you now. I don't know who that was and what that was. When and where is the next Metaphors of Movement training in England? Now, I don't know. This is one of those, I've got an awkward situation at the moment with an organizer who isn't very organized. Now, in theory, it's going to be next March in Glasgow. No, there's one in January. There's a 2-day event in Swindon. If you go to metaphorsofmovement.com, all the currently booked courses are on the website there. So metaphorsofmovement.com. You'll find the sign up there. There's going to be other dates being announced very soon. I'm just waiting on a few logistical difficulties with that one. Thank you, Andy. Thank you, Khan. I much appreciate that. Please, could you repeat the names of the authors and the books you recommended today? Yes, I can. Okay. Making Monsters. Making Monsters by Richard Offshee. And Offshee is O-F-S-H-E. Making Monsters by Richard Offshee. He's a co-author. There's somebody else that wrote it with him. And the other one is called Victims of Memory by Mark Pendergast. So Victims of Memory, Mark Pendergast. And I think it's Pendergast, but it might be Pendergast. You'll find it. Google it. Victims of Memory. Fantastic book. Don't be put off by the fact it's this big. It's a great, great book. Oh, Alan Johnson's going to have me back as well next year for Metaphors. So that will be near Newcastle, in Harrogate. I'll talk to Alan about that later this week. Thank you, Alan. Much appreciated. And thank you, Zippy, as well to you. And thank you, Judy. Okay, I'm done. I'm going to go and get something to eat. I would like to thank everybody who's participated with your questions here. Obviously, without any questions, couldn't do the webinar. Tomorrow, I'll edit this and I'll stick it up on the website somewhere. So if those of you know anyone else who have missed, they're going, I couldn't log in. I've got them. They've all emailed me. I'll have a copy of this on there. So thank you very much to everybody, and I wish you good night, and I will speak to you again very soon. Thank you.